This matter has been taken very seriously by the Senate. The quality of healthcare that we are giving our mothers and sisters is completely wanting. And it's all because of mismanagement of this hospital. And I think it is good that whatever was unearthed was unearthed. We, of course, wish to condole with the families of those children and the deaths that have been happening here. But still, even those babies who die deserve dignity. There's some facilities that are required here, cold storage facilities. Hawezi kuwa ati mama amejifungua mtoto amekufa anafungwa kwa juala, anafungwa kwa karatasi na anawekwa kwa box. Hiyo sio haki. Na kuna mambo ambayo tumeona, tumesema tutafanya upelelezi zaidi kama Senate. Tutaita uongozi kuanzia kwa governor, CECs wa health, chief officer, medical superintendent wa hiyo hospitali, na tufanye inquiry kwa Senate ili tuhakikisha kwamba watu wa Nairobi wanapata afya ambayo wanastahili.
Pumwani Hospital, a pioneer maternity hospital in sub-Saharan Africa whose name is derived from the Kiswahili word meaning breathe. But the facility is suffocating in drama.
Now, our reporter Cecilia Wakesho is at Pumwani Maternity Hospital and now brings us the highlights of the push and pull following the medics' suspension. Wakesho, what are members of the staff saying?
Thank you, Jesse. Indeed, here at Pumwani Maternity Hospital, since morning, it has been a beehive of activities, other than activities going on as normal here. We've also had one press conference after the other from officers in the nurses department and then the senators speaking here on their findings after a tour at this facility. It's a beehive of activities. But again, remember, this has been prompted by what transpired on Monday after Nairobi City Governor Sonko bumped into the holding area for the babies and bumped into 11 infant bodies into the facility. Something that has raised mixed reactions countrywide, across the country. People asking how comes that a whole facility like this that was begun in 1926, it doesn't have even just a cooling facility so far. So we've had the security committee going around and touring the whole facility, and according to them, really the situation is wanting, and they're saying that this is a time when we need to have an overall of the management of this facility, because they say even at the labor ward, from the holding facility up to the whole facility, really, there's need for much attention that what the hospital has previously been given. And for them, they're saying even as they prepare to have an inquiry, that is to have interviews with the Governor Sonko himself, the management of the hospital, they will be contemplating on perhaps upgrading this facility from county hospital possibly to a referral hospital. And just remember, for President Uhuru Kenyatta or the Jubilee government, one of the big four agendas has been health. They've said that they're thinking of achieving universal health care by 2022 and even reducing the mortality rates. But you see a situation like this, then it goes directly opposite. Remember, this facility has a capacity of 415 beds. It also receives up to between 60 to 100 mothers give birth here every day. But you only have 6 nurses who work in shifts. So you can imagine that burden. And that's why in the morning, perhaps we had a press conference by the nurses led by the official nurse or the presiding nurse here, saying that perhaps even the 11 infant mortalities that were realized between last week on Wednesday until Monday this week, they ought to have been controlled, or maybe the number would have been less, were it that probably we had proper facilitation here. The employees, the nurses, they are saying really they're not having it easy. Jesse.
Cecilia Wakesho giving us the latest information at Pumwani Maternity Hospital, which has been enshrined with various scandals. This being the latest, where Governor Sonko actually uncovered 12 bodies of infants in that particular hospital. Now let's just take a look at some of the developments that happened right after that. As you well know, Governor Sonko suspended 4 officials following a crisis county cabinet meeting that came after this impromptu visit at the Pumwani Maternity Hospital. These are some of the county officials, top officials that were suspended. Peter Kariuki, who was acting as the county secretary. We also have Veska Kangogo, who was the health CEC, Mahat Jimale, the chief officer of health services, as well as Lydia Kwamboka, the county attorney. Remember, this followed claims of there being an impromptu meeting, which Governor Sonko said that there was insubordination by members of staff following that particular meeting and what they had agreed during that meeting. The individuals who have been appointed following the 4 who were actually asked to step down are Pauline Kahiga, who will be the acting county secretary. We have Charles Kerich, who will act as the CEC of Health, Larry Wambua, the CEC of Devolution and Public Service, not forgetting Mohammed Saleh, who will act as the Chief Officer for Health Services, and last but not least, David Oseko, who will act as the county attorney. This all comes in the wake of suspensions following the impromptu and incognito visit by Nairobi Governor Sonko in that particular maternal facility. That's the Pumwani Maternity Hospital. These are some of the developments that happened right after that impromptu visit. Now, due to this particular story, we want to join the Secretary General of the KMPDU, that's Dr. Oma Oluga, to actually perhaps highlight some of the processes that actually should be followed in terms of getting the sacking of a medic. Now, Dr. Oma Oluga, thank you so much for joining us. Perhaps we know that Pumwani Maternity Hospital is under the leadership of the county government. Perhaps begin by explaining to us how suspensions should be made ordinarily. What would be the right procedure in sacking a medic?
Thank you very much, Rogers, and thank you for the listeners. First is, it's very unfortunate, these incidences that we continue to witness in hospitals. But also, I think the manner in which they are being handled is also quite unfortunate. And they leave a lot to be desired, not just in the governance, but also in the quality of the leadership that we are having in the county. Yeah. So first is to say that last year we signed a CBA, collective bargaining agreement, which Chapter 9 of that CBA actually stipulates the procedures that are supposed to be followed, not just in dispute resolution, but also in disciplining staff. And but the first step is to ascertain that an error occurred. And how do you ascertain that an error occurred? It's usually by the supervisor, the immediate supervisor. So, for example, in Pumwani Hospital, the medical superintendent should have said that this doctor or this nurse or this staff has this kind of an issue, and we intend to follow disciplinary procedures. And then after that, it goes to a disciplinary committee, which the union actually is supposed to sit in that committee, according to our CBA. And then after that, it is escalated to the level of the county, where the chief officer may then take action before it gets to the level of a governor. So I think the governor for Nairobi is trying to run the county as if he's running a club. And that is very lawless of him. I think we are not going to allow such kind of a gross violation of labor practice. And I think he is also creating very dangerous precedents for even other counties and for other officers. I think at this particular point, we as KMPDU are very disappointed in this kind of actions, and we have demanded that there should be immediate reinstatement. There are quite clear procedures on how to interdict, how to suspend, how to terminate the services of an employee, not just in the Employment Act, but as I've also mentioned in our collective bargaining agreement.
Well, thank you, Dr. Omo Luga, for actually shedding light on the processes that should be followed.